the country is still wrestling with the COVID-19 pandemic, deaths from drug overdoses have been spiking and are expected to top 100,000 for 2021.
For the first time, more Americans died from overdoses than car crashes and gun fatalities combined during this pandemic. Now,
taxpayer dollars cover wellness services, medical care, and connections to rehab. But since the drugs brought in are illegal, only private donations fund the drug supervisionary.
People are often practicing harm reduction, but they aren't calling it that. They aren't recognizing it as that. And so we do a lot of discussion around, seatbelts, right, and speed limits, and really pragmatic public health strategy.
Nearly 30 years of research shows syringe services programs are safe, effective, and cost-saving tools that can prevent HIV and other complications among people who use drugs.
I believe that harm reduction
is a movement that is never going to stop.
That advocates for human rights, that advocates for humanity, that advocates for being a whole human being. And
harm reduction is the first step in recovery. Syringe services is the first step. But now we have the ability to start people on life-saving medications for opioid use disorder. We're helping people in their recovery, but wherever they are on that spectrum.
Good morning. Y'all gotta give me a little better. Good morning. Oh, I heard somebody over there. Good morning, my name is Ken Pettigrew. I'm the Capacity Director at Health HIV. Welcome to the inaugural DC Harm Reduction Conference. Welcome, welcome, and welcome. I'm gonna give you all a phrase. Just give it. We're going to say this all day long. Engage. Promote, reduce. So every time I get up here, y'all are going to say that, and you're going to receive it, and you're going to believe it. We are going to what? Engage. We're going to what? Promote. And then what? Reduce. All right. Thank y'all. Give yourselves a hand. I do want to say, why are we here? We're here because of the state of harm reduction, overdose, stigma in the district. It's so important that we address this. And DC Engage is a project that does address, and I don't want to use the project, it is an opportunity to address what's going on in the District of Columbia. I'm going to give you a real quick snippet of what happens in DC Engage. It is a project funded by the District of Columbia's Health Department. The goal of it is to reduce harm reduction by we have micro grantees. You'll see their information out there. They're out on the streets doing the work. They're out on the streets passing out Narcan kits. They're out there talking to me. They're out there talking to people like you. We have outreach workers and outreach organizations who also do the same thing. Then we also have e-learning, so you can go online and learn. So there are many opportunities to learn with DC Engage. So I do want to do a quick overview of our agenda. And I mean the biggest mistake on the planet. I'm up here without my reading glasses. Y'all want to see how that goes? Go ahead and take a look at your agendas, if you will. We do have a full agenda today. I will say that I just want to tell you where you are. We are in the main ballroom. So there are sessions that will be held in the main ballroom and the auditorium. The auditorium is to your left, to the far left, and other sessions will be held upstairs on the second floor. There are arrows that will point you toward those. I want to do some housekeeping because that's important. All sessions, as I said, are in the 3 rooms. During breaks, be sure to check out our resource guide, resource spaces out there. A number of people have their resources. DC Health is out there, our micro grantees and our outreach organizations are out there as well. Lunch is going to be provided out there, and we'll direct you to our lunch to be served in the foyer. Lastly, we want you to plan to hang around for our networking event, which is going to happen this evening or later this afternoon. Is an opportunity to hear from you. I do want to say real quick that this is a place for us to come together to do what? Engage. What? Promote. And what? I'm going to tell you what it's not. It's not a therapy session. It's not an advocacy opportunity. It is not a political event. And I think that's important because we need to know why we're in the room, because we are here to engage, promote, and reduce. So what I also wanted to do is let you know who's in the room. There are a whole lot of people in the room, different kind of folks in the room. I think that's important. That's why we ask you to fill out the registration so we can see who's in the room. If you're a non-clinical provider, stand up. Non-clinical. Look around and see who's in the room. These are the folks here to engage, promote, and reduce. If you're a clinical provider, stand up. These are the people in the room are here to engage, promote, and reduce. And if I didn't call you out by profession, stand up. Anybody else in the room? Specialists, CHWs, peer specialists, all in the room. So give yourselves a hand and thank you for doing this important work. So I'm gonna keep this joke running. Since I forgot my glasses and left them downstairs, I'm gonna go by the fly. And this is our own Senior Deputy Director at HAHSTA. I've known Clover Barnes for years. She's an amazing person. She is a leader. She does the work. She's a hard worker. She is engaging. She brings her team together. She brings this community together. So when you get a chance to read her bio, read it. But this is the person you need to know. This is leadership in action who is here to engage, promote, and reduce. Clover Barnes.
Well, I'd be willing to say that's better than reading my bio, right? At this point, good morning. As Ken said, I'm Clover Barnes. I'm the Senior Deputy Director at HAHSTA, which is the HIV/AIDS, Hepatitis, STD, and Tuberculosis Administration at the DC Department of Health. I am new to my role, about 8 months in, and I'm so happy to be here with you this morning. I previously was with the Health Department in a role overseeing Ryan White, HIV care and treatment. So some of you may know me from that realm. I'm super excited to have you all here today because harm reduction and reducing stigma is of utmost importance at this time. There's so many triggers and viruses that are coming at us between COVID and monkeypox and HIV and opioids. It's all a lot, right? And we all know there are things that are impressing on people and triggers that can cause people to relapse into places where we don't want them to be. And so this is a time for us to meet the people where they are, to reduce the harm as best we can without stigmatizing and without trying to lead people to the place we want to be, but lead them to the place that they want to be. It's so important that we reach people where they are and we engage them on what they want to do, right? We have lots of things we want to do as public health professionals. We always want to cure everything and get rid of everything, but not everybody's ready for that. And we have to understand that and meet people where they are. So I appreciate all of you for being here this morning and engaging in that work. I'm gonna use Ken's, you're engaging in that work. We're gonna do what? Engage, what was the second? Promote. So I'm here promoting you, right? I appreciate you and all that you do. I know it's not easy. This isn't the easiest population to work with. It's not the easiest work to do. So thank you for all that you do. And all together, we're gonna reduce the number of people who are affected by these diseases. So thank you so much, and I look forward to meeting you all as the day goes on.
So before our next speaker come up, again, I'm gonna put some stuff out there throughout the day. If you notice, it says drug user help. It didn't say ex-drug user help. It didn't say long time. It says in the moment. There's a continuum around drug user health, and we have to respect that, and we have to be engaged, we have to promote that, and we have to reduce the harm. So, keeping us on task, I think it's important that we look at things from a national perspective. And so what I wanted to do today is take a look at what's going on from the national. As the day goes on, we'll come closer and closer to the community and to you. But we thought we'd start this time off with someone from SAMHSA. This is Kristin Roha, who's gonna get mad at me too because I can't read her bio. I'm going to find my glasses, I promise you. But for now, she's been an amazing person to work with in terms of just getting to know her. In the last couple of weeks, she's been engaging. She was so excited to be here. I'm so excited to introduce her and give us the landscape from a national perspective. Kristin Roha.
Thank you very much. And yes, my name is Kristin Roha, and on a personal level, just to introduce, I am a native Washingtonian. I was born in DC, and I grew up in Tenleytown, where I was a resident for 38 years. I am also here today representing SAMHSA. So SAMHSA is the Substance Abuse and Mental Health Services Administration. And SAMHSA's mission, you see on the slide there, is to reduce the impact of substance abuse and mental illness on America's communities. And my role there is as a HIV, hepatitis, and other STI epidemiologist, also working amongst people who inject drugs and use other substances as well. So, as has already been said, we know that overdose deaths have increased dramatically over the course of the COVID-19 pandemic, and that provisional data indicates that we did surpass that 100,000 death mark compared to the same time the year before. And SAMHSA recognizes that harm reduction services save lives and are available to people in a manner that emphasizes their humility and compassion towards people who use drugs, not who use drugs, but people who use drugs, live in living experience. So harm reduction, as part of the Biden-Harris administration, harm reduction is being emphasized with a comprehensive approach to addressing substance use disorders through prevention, treatment, and recovery, where individuals who use substances set their own goals. And SAMHSA's harm reduction program is designed to meet people where they are on their own terms and may serve as a pathway either to other prevention or treatment or recovery services. And SAMHSA strives to address broader health and social issues through improved policies, programs, and procedures. So we also fund the National Harm Reduction Technical Assistance Center with CDC. This Technical Assistance Center, you can see sort of the things that it does there on the slide. But the TA Center strives to expand capacity, increase effectiveness, and strengthen the performance and accountability of harm reduction services. So at the community level. So I think I'm going to leave it there for now. I think that's my last slide for here. So just as a teaser, I'll be back up here during the closing plenary as well, where I'm going to talk about some SAMHSA harm reduction grant programs that are currently or about to be funded for FY23, which starts October 1st. And again, thank you so much for inviting me to be here today. I look forward to meeting all of you, providing that national perspective. And also, again, I am a native Washingtonian, so a local perspective as well. So thank you very much.
Guess where my glasses were? The one thing that, one of the words that I typically use is grace. Grace is a space for mistakes, leaving your glasses up here. And that's certainly going to happen today. There'll be mistakes, but I think we get to laugh through them, and we get to cry through them, and we get to talk about them later. But at least you all know I found my glasses. So what I want to do now is I'm going to ask you a big favor, or at least some of you. There's a couple of empty seats up here, and y'all know we do this at every conference. I know y'all scared to sit at those front tables, but can some of y'all come up just a little? There might be a gift card under the table. Please? No movement? Just a little? Jason, thank you, Jason. There you go. Anyone else? One more. All right. So now I'm going to do something a little different. I'm going to ask for a volunteer who does the work, and I want you to come up here and tell me why you do this work. And if I call on you, you're going to be in trouble. Who's coming up here? Y'all going to make me do this? We got a volunteer. All right. want you to tell us your name, where your agency you're from, and why you do this work. You can come up. Hold on.
Good morning. My name is Sandra Sanders. I'm a certified peer support specialist and recovery coach. I am an outreach worker for the Volunteers of America. And I do this work because I'm also a person in long-time recovery. I have not used any mood-altering substance since April the 8th of 2004. That's 18 years. And I do this work because I want to be the change that I want to see. And I understand wholeheartedly when I meet people in the street, because me and my team, we work in the street. And I want people that know me, that seen me before, know that there's a possibility for them too. So that's why I do this work.
Good morning, everybody. My name is Shiree Forney. I'm a community health worker with the infectious disease department. On the social service side, I'm a community health worker. As our other peer specialists, I do the same thing, go out on the street. I've been doing it for like 10 years. I never thought I would be getting paid to do this. I've been doing it all my life, but it is a blessing in disguise. People are scared to have a conversation. So start the conversation. Try to make it a little easier. Plant the seed and it'll grow. And that's why I love to do what I do. And we will engage, promote, and reduce while we continually do this.
So again, we engage, we promote, we reduce. I do want to take this opportunity to thank the folks at HAHSTA who do this work. They are project officers and help us and guide us in our work. And I mean that sincerely, that they help us do our work. They are partners with us, and it's important. So I want to introduce at the table over here, Nesta Rocha, who's the division chief at HAHSTA, and your Donald Haley, who is our project officer. And I just want to thank them for their guidance in this work, this important work. They teach us, they help us in doing this work. Today, this also has to be about wellness. It has to be about the community wellness, it has to be about the organizational wellness, and it has to be about the personal wellness. We're going to guide you through that today. And so I have a really great colleague of mine, Ebony Johnson, who's been doing this work since she was 4. She reminded me that I was her supervisor 20 years ago. So she was 4 years old and she worked for me. Ebony is a strategist. She does a lot of work around harm reduction. She does a lot of work around affirming care. And we all need affirming care. So I'm gonna let her tell you a little bit about herself, and I'm gonna let her begin setting the stage for how we're going to help ourselves and be involved in wellness throughout the day. I will say this, if something triggers you, find somebody, grab somebody. Don't sit in it, but be in it. And so take a moment and take a breath, because you're gonna hear some things today. And so just be prepared, but also grab me, grab someone else, go outside, stand for a minute. Be in this space today and be well. Ebony.
Good morning. Good morning. Y'all, we haven't been together for 2 years. Good morning. Good morning. I'm excited to see you. I am excited to be on Hollow Ground in 2022. There are some people who are not here with us. Do we agree? There are some people who didn't drive to the Kellogg Center this morning. There are some people who we have been grateful who might have made it to the Methadone Center this morning. There are some people wanting a place to be this morning. And we're here. Y'all, we look good and we're here, right? Some of y'all not sure, are we here? We looking good? I'm here today because I want to bring a message of healing for the helpers. I'm here today because I have a calling for healing for the helpers. All day, you're going to hear messages There's going to be dialogue. There are going to be conversations. There are going to be presentations about how you can care for the community. People are going to be talking about empathy. They're going to be talking about meeting people where they are. You're going to hear messages that say, don't judge. You're going to hear messages that say, be there, that you might be a lifeline for somebody. But let me explain something to you that I know you know, but I want to explain it with the invitation for you to give yourself permission. Can we say that word, permission? Just say, I give myself permission, because I want y'all to be fertile to hear this. I give myself permission. I give myself permission to rest. Let's say it again. I give myself permission to rest. Because as helpers and healers, some people in this room, this is not an academic exercise. Some people are not coming here because you have a degree in public health, because of your dedication lifelong to human services, because your mother had you out there on a campaign trail at 4 years old. I started my career at 4 years old, as you heard. For some of us, this is personal. This is about family and friends and loved ones and journeys once taken and roads never to be crossed again. And so people oftentimes don't get the reminder that as helpers, as healers, as change makers, as leaders, as trusted members of your community, that charity starts at home. That charity starts at home. That I don't want anybody in this room pouring from an empty cup. It is not by accident, with all that we know of the dynamics of the indomitable 2022, that we are here together. It is not by accident that you are doing sacred work. But that same care that you are resonating, cultivating, curating has to start here. And so some of you might still at this point think I'm talking about going to the spa. Some of you might think I'm talking about my yoga practice. I'm talking about knowing when you have to close the laptop. I'm talking about Stacy, who I have worked with for decades, saying, Stacy, that's the last email for the day. It's about handing the torch and telling your colleague, I trust you and I need you to take this today. Because right now, that triggered me. Right now, there's some stuff, and what I might need to do is call my therapist, my imam, my rabbi, my minister, my prayer partner, my psychic advisor for some of us, right? And whatever it is of your understanding. Because so often we're doing this work that sometimes might feel a bit thankless. When we're talking about harm reduction, when we're talking about change, when we're talking about human beings, that instant gratification that we're used to in a microwave society, sometimes you don't get that. Sometimes we get what human beings give us, which can be challenging and tired and patient. And so in the process, we have to find the quiet moments to restore ourselves. And some of you in here feel like you're paying off a debt. Can I be that honest today? Some people in this room feel like they are paying off a debt. For all the streets I walked, for all the drugs I used, for all the loans I didn't pay back, for all the stories I told, for all the promises I broke. Let me tell you today, go ahead and release that. Go ahead and release that. Remember, we said we're talking about permission. Go ahead and release that, because if this is your purpose, be purpose-driven, but don't be guilt-riddled. Because when we're talking about giving ourselves permission to show up, part of that is giving ourselves permission to get just a little bit lighter. Giving ourselves permission to be just a little bit freer. Giving ourselves permission to show up and show out just a little bit more. It's good to wake up with a purpose. Anybody in here have a purpose? It is good to know you're doing that thing that's going to make somebody's day better, moment better, life better, spirit richer, that's going to make them feel accepted, heard, seen. Because see, a lot of you in here have healing hands and healing hearts. You might be the first person that's working with that client and allowing them to just be. But I want to ask you to shine that light right back on yourselves and give yourselves permission to just be. Is that okay? I want to speak to you, Queen with the locks. Can I speak to you? What's your name? Tell us all. Stephanie. Stephanie, what is it that you want to give to yourself? As you're doing this work, as you're called to this mission, as you're purpose-led, purpose-driven, how do you give some of that back to you? What do you commit to today?
I commit to learning, having an open mind, just being, relaxing. I'm feeling good already.
All right. Can we give it up for Stephanie? Nesta, I haven't seen you since before the pandemic. You was working then. I guess you're still working now. What are you going to commit to so that you can give more because you have more? What do you commit to for self?
I guess I want to see our communities improving their health.
See, I want you to take off your public health hat. I want you to take off your Department of Health hat. And I want you to put your own right in on justice. That's the boy, the teenager, the man, or the senior. What are you going to put in and with your effort?
I guess I want to be out of work. I want to be done.
Was that powerful? And see, it takes practice. Say it again. He said he wants to take care of the community. He wants to heal the community. But I said, well, what you do for yourself? He said he wants to be out of work. Means he wants to be in work. Can you hear me? All right. They didn't hear you. Yeah.
So what I answered is I guess I'm working to basically end up being out of work. So that way my work is not needed anymore.
And you see, it's hard sometimes for us to even shift when you are a giver, right? When you are a doer, when your very identity is defined by the logos and the work and the community. Oh, that's Miss So-and-so that always got the, oh, you gave us those clean needles last time, didn't you? Right? And it becomes so much of you that sometimes you don't recognize that assumes your identity. You don't feel good if you're not helping. You don't feel good if you're not running, if you're not out on the van, if you're not putting up that next policy. But we don't realize The more we pour in, the more we have to give out. Let me bring it to you. I've seen you've been making eye contact. This has been resonating with you. Something is happening over here. What are you going to commit to doing today for self? More for you so you'll have more for them.
I commit today to take a minute in the moment to do what I need to do, even if that's just a breath, even if that's a cup of coffee, walking around the block, doing something that takes me, that allows me to recenter myself so I'd have more to pour in when I need to pour in.
Fantastic, fantastic. Can I get a time check? How many of you always on time for your client appointments? How many of you don't leave the office until everything is done? Till you responded, till you called back, till you followed up, till you followed through? And how many of you put some personal things aside? I can be late for me, but I can't be late for them. So we want to shift and find that balance. When we're talking about healing for the healers, we're talking about healing for the healers. I'm going to invite everybody on their feet, if you would. When we look at DC, Maryland, Virginia, and sometimes we look in joy when we see all of the new buildings, all of the beautiful structures, and sometimes when we look, it's a bit harder, right? Because we see everything in between. But then there are days like today. I want us to be present of where we are in this moment. In safety, in air conditioning, in light, in community, but most importantly, we're here in shared purpose. Most importantly, we're here in service. Most importantly, we're here for those who can't be here. Most importantly, we're here because we have a calling. So I want you to slowly look around the room and appreciate those who are in service. Just take a spin around, look around. I want you to see people who have gotten up day after day and deciding to be in purpose. I want us to say this together. I am, and I want you to look at some folks. Don't look at me. I'm good. I want y'all to be in community. Look around the room, and I want you to say it with me. I am. I am. I am. Because you are. I can do nothing without you. I need y'all to mean it. I can do nothing without you. But with you, with you, back there with you, we can do anything. Everybody, I want you all to have a great day. I want you to soak it in. I want you to radiate that energy. And I want you to remember your purpose. And I thank you for allowing me to share this morning with you.
Well, if y'all don't feel better, I do. Thank you, Ebony. Thank you for that. Wow. What we're going to do now, I'm just going to walk you through the day, the exciting day that we have in front of us. We're in the plenary session now. We heard great remarks from folks like Clover We heard great remarks from Ebony. We heard what's going on the national stage from Kristin. We're going to have a coffee break, which is going to be outside in the foyer, and we'll do that from 11 to 11:15. We've got some amazing sessions this morning. The first one will be on monkeypox and harm reduction, and that will be here in the main ballroom. The second session that will go on concurrently will be public education during an outbreak. That is going to happen outside here and upstairs in the room 4. The next session of the morning will be syringe services programs in a COVID environment. Those will be in the auditorium. The auditorium, again, is all the way down to your left past registration. We've got an exciting plenary coming up. We have been working with some exciting people. We call them our community partners. We sometimes call them our micro-grantees. I call them our friends. Alliance of Concerned Men, Capitol Ballroom, Empowerment Enterprise Squared, Far South Side Family, Strengthening Collaborative, Father Factor, Harm Reduction of Westminster, Energy Inc., Marshall Heights Community Development Organization, National Association of Returning Citizens, and Project Briggs. This is an array of organizations out there doing the work, and they are doing what? Y'all off, let's get it together. They're out there doing what? And reduce. Y'all gotta remember that. I need y'all for that. I need that energy Ebony talked about. So that's going to be our plenary, and we'll also have an exciting performance from one of our community partners, Cage Bird Productions. For our afternoon sessions, which will begin at 1:45, we have current and new treatment approaches. Those will be here in the main ballroom. Our second session will be upstairs. That will be behavioral health models for integrated care. Then we also have an exciting exciting session, which is going to be reducing stigma. That one will be in the auditorium. We're going to have a refreshment break at 2:30. That will be also outside in the foyer down to your left. Our afternoon breakout sessions will include drug user health and workplace policies. That will be, again, here in the main ballroom. We'll have an exciting findings from a MAT survey that was done, and where do we go next with MAT services? That will happen upstairs in room 4. We'll then have an intersectionality between infectious disease and drug use. That's going to happen in the auditorium. We'll have our closing plenary. We're going to bring you back here, and we want you to come back energized, revived, as Ebony said, and full of new knowledge. That's going to be here in the main ballroom, and then we're going to have an amazing reception. We want you to engage, promote. This time we want you to network with each other. We want you to get to know each other. That is going to be outside in the foyer here. That's going to be down the hall in the foyer. So this is our agenda for the day. I want you to do as Ebony said and be in the space. I want you to be in the space in the session. I want you not to be afraid. I want you to challenge yourself. And I want you to learn. But again, I want you to all right, y'all getting there. So I want to thank you. The last thing I want you to do is for our many grantees, our community partners, they've worked hard this year, but they also want to show off. They want to tell you the work that they do. They're outside. Please enjoy the exhibits outside. We have a lot of them out there. They want to tell you what they're doing and engage you in their work. Until then, I believe we are at the end of our morning session. And I want you to take that energy that you got in here, take it out there, and we'll see you in your sessions, and have a great day. Thank you.